Scottsdale nurse is facing multiple felony charges, accused of injecting patients for a doctor who has no medical license here in Arizona. The nurse offered injections to an...
Hi, I'm Dr. Kate D, and I'm interrupting my usual podcast to talk about the latest breaking news out of Seattle, or Seattle related, about a board-certified cosmetic dermatologist who is under federal investigation right now. There was a sting operation in Scottsdale, Arizona that led to an RN being taken away in handcuffs, and she is now being charged with felonies, 3 felonies. And a dermatologist named Dan Levy was her boss. And this is such a mind-blowing story to me because Dan Levy is a pretty well-known board-certified dermatologist here in the Seattle area. He had a practice here called Levy Aesthetics in Bellevue. And he's very well-known. He's very prominent. He's a trainer for Allergan, meaning he teaches other people how to do aesthetics for Allergan. And he is a really nice guy. He's actually done a training in my office once a number of years ago. Super great teacher. And he's a very, very well-established doctor. And I'm going to tell you the story about what happened. I'm blown away by this myself. So let me just tell you, apparently he was interested in opening a medical spa in Scottsdale, Arizona. I don't know why Arizona. He must have a connection there. But he was looking to open a spa there. And he hired a 25-year-old registered nurse named Alexandria Baggett to act as a provider there. And before that, he had run ads looking for a nurse to work there. And he interviewed another RN and offered her the job. She turned it down. Why? Because she did her homework and found out that Dan Levy does not have a license to practice medicine in Arizona. So he can't practice there. So she turned the job down saying, I can't do this. So he found Alexandria Baggett and hired her instead. So Alexandria was practicing under him in Arizona. That's completely illegal. A doctor in another state can't practice in your state. So for instance, if you're in California and you've got an infection, you're talking to me on the phone, I say it sounds like an infection, I can't call you in a prescription for antibiotics. In California, I don't have a license there. Okay. So, and every doctor knows this. So he knows he is not supposed to practice medicine in a state where he doesn't have a license. But anyway, he's opening up a whole office down there. And how it is that he could interview this nurse before Alexandria, this other person, and think that he didn't need to turn around and go, oh gosh, you're right. I do need to go get a license. Anyway, he didn't. And what happened? That RN who didn't take the job reported him to the Attorney General of Arizona, who did an investigation. And I don't know what materials they found, but they obviously found a lot of evidence. The local news in Arizona talked about their having emails or text, some written communication where the RN, Alexandria, admits that she knows that he does not have a license. Okay. So she knew that what they were doing wasn't legal, and he obviously knew. Anyway, what did the Attorney General office in Arizona do? They put on a full-on sting operation. They did kind of a secret shopper, made an appointment. One of the Attorney General investigators made an appointment with the RN, went in for the appointment, and the RN, who can't practice, can't do a good faith exam, cannot do an assessment, cannot prescribe, went ahead and did all those things and prescribed, offered the injection of semaglutide, which is a generic Ozempic, to the investigator, at which point they arrested her. And they are actually charging her with 3 counts of felony, 3 felony acts of practicing medicine without a license. Now, interestingly, the investigation is ongoing. I don't know what's going to happen to Dan. The local news in Arizona interviewed a legal expert named Josh Coles-Root. He's a criminal defense attorney. He appeared on local news down there, and he talked all about the possibilities of what might happen. He said that basically they will probably try to charge him with wire fraud, or it's crossing state lines. It's a federal offense, which is also a felony, right? So, and that he could face up to 20 years in prison. So let's unpack this for a second here. So first of all, why not just get an Arizona license? How hard is that? Well, I wanted to figure out, because I'm also a doctor in Washington, how hard would it be for me to go to Arizona and get a job there? Well, to do that, I would have to prove Arizona residency. So this is for them to recognize my license in Washington. I'd actually have to prove that I lived in Arizona, which I don't know if Dan did or not. No idea. You have to be currently licensed in another state and be in good standing, okay, and no disciplinary action against you, which I'm sure he's in good standing. I don't really know. Haven't looked that up. You have to be eligible for a medical license, have all the education, work, exam, or clinical supervision, which I'm sure he had all those things. You'd have to complete a criminal background check. I'm assuming he would have passed that. The one thing that was an obstacle is you have to take and pass an exam under Arizona state law. I don't know what the exam is. I don't know how hard it is, but if you're board certified in dermatology, you've obviously already passed all your medical boards and your board certification board. So probably he would have passed, but he never took it as far as I know. Then you have to pay a fee. So I think the only thing that would have been preventing him from getting a medical license in Arizona was taking this test, but he did not do that. So the other thing that is very suspicious is if you do not have a medical license in a state, you can't actually buy Botox or filler or any of the medical devices or prescriptions. You can't get them because in order, for instance, to get an Allerganic, you have to fill out a form and you have to put your Arizona or that state license in it. And so he would have had, in order to add a ship to, let's say he already had an Allergan account in Washington, I'm sure he does. In order to add a ship to account in Arizona, you would have to prove that you had an Arizona license. So if you've been listening to the show, you know I've got stories for days about what goes on in med spas. I finally put them all in a book. It's called MedSpa Mayhem. I wrote it because I got tired of hearing about people getting hurt by providers who have no business holding a syringe. You'll read about real patients, real nightmares, but more importantly, you'll know exactly what to look for when you walk into any med spa and what questions to ask. It's part expose, part survival guide, and it might just save your life. MedSpa Mayhem will leave you informed, entertained, and a little shocked at what's really going on behind the business of the aesthetics industry. The link is in the episode description. Read it before you book your next appointment, because beauty should never come at the cost of your safety. And so my guess is he didn't have to fill out a new form for his Allergan account. Or if he did, I don't know. I just don't know. It's a mystery to me. But in order to get Botox in Arizona, he would have had to do that. So he was a trainer for Allergan. I don't know. I just don't know. It shouldn't have been possible for him to just get it the normal way and have it shipped directly to his office. Could he have traveled with it? Well, Botox has to be on dry ice. So you really wouldn't be able to travel with Botox, especially to the desert. Could you ship it yourself? I mean, again, it has to be on dry ice. So to me, that's a mystery. How did he get it? Don't know. And then the other thing is that clearly there was no one doing a good faith exam. So we've talked about what is a good faith exam. That's when it's the first time you go see a doctor, any new medical place. You know how they give you that form where you have to fill out this whole long, giant list of things, all your review of systems, everything, every possible thing from, do you have a chronic cough to, how regularly do you poop? Okay, they ask all those questions. And when in my place, we don't actually ask you about your poop, but we do ask you about all the different things that could affect your skin or anything that you would have when you come in for any kind of aesthetic procedure. Anyway, we do that assessment. Then we assess your skin, we assess your problems, we make a plan, and then we prescribe whatever treatment plan, right? RNs can't do that. They're not allowed to. It's in no state can an RN do that. So he set this up so that this RN's on her own. He's not in Scottsdale, or at least he's not there all the time. And so she clearly was doing it in this case with the sting operation. She did the good faith exam. That's also not legal. It's very confusing to me as to how he could have set all this up when he's been in the business for a really long time. And then the last thing that makes no sense to me is that he interviews this RN, right, to have a job. He offers an RN the job, and she turns him down because, hey, this isn't legal. So she's now saying, hey, you need to get a medical license or I can't work here. Why he thinks she's not going to report that? I mean, it was her duty to report that, right? Now, she could have reported it to the medical board. She could have reported it to the AG's office, or both. I don't know. And in the past, when people have asked me, and we've talked about this as well in previous episodes, if you know that somebody is definitely doing something illegal or unethical or immoral or any of those things, you can report it to the medical board if they have an MD or a PA license. You can report it to the nursing board if they have an NP or RN license. And you can report any illegal activity to the attorney general of your state. That's who would be investigating this. So my guess is this RN probably reported him to both. But since he does not have a medical license in Arizona, the medical board has no license to revoke. Now, what will happen to his Washington license? That is a good question, because he hasn't, as far as I know, well, maybe he has. I don't know. I'm sure he's being investigated. But the law we know he broke was in Arizona. He didn't break any law in Washington that we know of. Okay, but the Washington Medical Board may have something to say about this. I don't know. The legal expert that appeared on local TV in Arizona suggested that he could potentially lose his license in Washington as well. So why am I doing this work on the medical board? It's for this exact thing, okay? It is not uncommon that all these things are happening, that felonies are being committed in every town and every state. But there's been, up until now, there's been very little enforcement. So when I've been talking about how practicing medicine without a license is a felony, and RNs are doing this all over the country and med spas all over the country, this is the first that I know of that someone's actually being charged with a felony. So I hope that you'll do all your research when you go to see a new med spa, even if it has a great reputation from somewhere else and they're opening up a branch in your neighborhood. Do your research, find out who the medical director is, and look up their license. Keep saying it, look up their license, because they might not have one. And then make sure that the medical director is actually present and somebody who's allowed to do a good faith exam is actually doing one. And then, of course, make sure that your particular provider who you end up seeing for that laser or Botox or whatever actually has a license in that state and that that's active and in good standing. Meanwhile, the MedSpa Board is up and running and we are taking applications. So if you have a med spa that is totally legit and doing an amazing job, or if your med spa that you go to for your Botox is amazing and they're doing an amazing job, tell them to get certified. We are totally ready for them. So thanks for listening. And until next week, I'm Dr. Kate D. Thanks for listening. If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one, and drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.